we are finally into the last topic of the front of the thigh. So in this class, we are going to discuss about the anatomy of adductor canal. It is also called as the Hunter's canal or subarterial canal because of the presence of the subarterial plexus. If you see the extension of this canal, it extends from the femoral triangle above to the tendinous opening at the adductor magnus below. So let us see the extensions here. You know that this is the apex of the femoral triangle, right? This is the apex of the femoral triangle. So here it extends from the apex of the femoral triangle above to the tendinous opening up to the tendinous opening at the adductor magnus below. So this is the extension of the adductor canal. For example, if you see this adductor canal in cross section, this is the cross section of the adductor canal in the upper part where it is triangular in shape. In the upper part it is triangular in shape. So now we shall discuss about the boundaries of the adductor canal. So let's have a quick review about the extension of the canal. Adductor canal is a triangular canal which extends from the apex of the femoral triangle above to the tendinous opening of the adductor magnus below. And if you see the cross section of this adductor canal, it is triangular in shape, having three boundaries: anterior wall, posterior wall and the medial wall. Okay, so now let us discuss about the structures which are forming the boundaries of the adductor canal. So here let us see the anterior wall here. The anterior wall is formed by, this is the anterior wall. Anterior wall is formed by vastus medialis. Anterior wall is formed by vastus medialis, and the posterior wall is also called as the floor of the canal. The posterior wall is formed by the adductor longus above and the adductor magnus below. What does it mean? Let's see here. I told you that this is the extension of the adductor canal from above to below, right? If you clearly see in its upper part, posteriorly it is formed by the adductor longus. Here you can see the muscle adductor longus which is passing behind the canal, right? So in this picture you are seeing the cross section of the adductor canal at the upper part of the canal, right? That is the reason the posterior wall or floor is formed by the adductor longus. But if you see in the lower part of the canal, so there is another muscle which passes behind the canal. This muscle is called as adductor magnus. So that is the reason in the upper part of the canal, the floor is formed by the adductor longus, and in the lower part of the canal, the floor is formed by the adductor magnus, right? So here we are discussing about the boundaries of the adductor canal. It has anterior wall, posterior wall. Posterior wall is also known as the floor of the canal. Posterior wall is formed by adductor longus above. So adductor longus above or adductor magnus below. Because I told you that in the lower part of the canal, the posterior wall or the floor is formed by the adductor magnus, right? Yeah. And coming towards the medial wall, it is also called as the roof of the canal. You can see here, it is the medial wall. The medial wall is also called as the roof of the canal, right? And this medial wall or roof is formed by a strong fibrous membrane. You can see here, it is a strong fibrous membrane which joins the anterior wall and the posterior wall, right? So this is the medial wall. Medial wall is also called as the roof of the canal, and the medial wall is formed by a strong fibrous membrane which joins the anterior wall and the posterior walls. And this strong fibrous membrane is bounded by, or it is covered by, the sartorius muscle. Here you can see, this is the sartorius muscle, a strong fibrous membrane which forms the roof of the canal is bounded by the sartorius, and which is separated from the sartorius by subarterial plexus. Here you can see the small nerves which are present between the strong fibrous membrane, that is the roof of the canal, and between the sartorius. These are called as the subarterial plexus. These subarterial plexus are the nerves which are derived from the medial cutaneous nerve of the thigh, the saphenous nerve, and the anterior division of obturator nerve. So these three nerves gives off small branches called as subarterial plexus. These subarterial plexus are present between the sartorius muscle and the strong fibrous membrane which forms the roof of the canal. I will repeat again about the subarterial plexus. The subarterial plexus are derived from three nerves. What are those three nerves? We will mention here. Okay. So first one, they are derived from medial cutaneous nerve of the thigh. Medial cutaneous nerve of the thigh. Second is the saphenous nerve. The saphenous nerve. And the third is anterior division of obturator nerve, formed by the anterior division of obturator nerve. So these subarterial plexus are derived from these three nerves. So now we know what are the boundaries of the adductor canal, right? Anteriorly it is formed by the vastus medialis. Posteriorly it is bounded by the adductor longus above and the adductor magnus below. The posterior wall is also called as the floor of the canal. Next, coming towards the medial wall. The medial wall forms the roof. The roof is bounded by a strong fibrous membrane, and this strong fibrous membrane is bounded medially or bounded by the sartorius muscle. The muscle is separated from the membrane by subarterial plexus. These subarterial plexus are derived from three nerves: medial cutaneous nerve of the thigh, next is the saphenous nerve, and next is the anterior division of the obturator nerve. So after knowing the boundaries of the canal, let us discuss about the contents. In the contents, first we will take the femoral artery as a reference here, right? So here I will write, this is the femoral artery. I will take the femoral artery as a reference. Okay. So now, for a generalized point of view, behind the femoral artery in the adductor canal, in its upper part, because you are seeing the transverse section of the canal in the upper part, right? So in the upper part of the canal, we can see the femoral nerve behind the femoral artery, right? And now if you see, immediately anterior to the femoral artery, we can see saphenous nerve. Immediately anterior to the femoral artery we can see saphenous nerve, and lateral to the femoral artery we can see the nerve to vastus medialis. So these are the relations of the femoral artery in the upper part of the canal. Okay, and how they change in the lower part of the canal, and what are the relations of the femoral artery in the lower part of the canal, we can discuss by seeing this picture in detail. Okay, so now I will take the reference of the femoral triangle first. You know that the femoral artery extends from midinguinal point towards the apex of the femoral triangle, and in the femoral triangle we studied that medially, in the femoral triangle we have medially the femoral vein, but by the time it reaches the apex of the triangle, you can see the femoral vein runs behind the femoral artery. The femoral vein runs behind the femoral artery, which means at the apex of the femoral triangle, the femoral vein is posteromedial or posterior to the artery. Okay, so it is, generally we can say it is posterior to the artery. What it is, in the upper part of the triangle, the femoral vein is medial to the artery, but by the time it reaches apex, the vein runs posterior to the artery. So that is the reason, if you see in the upper part of the canal, you can see here it is reaching towards lateral side, and this is the vein is reaching towards the lateral side, and the artery is coming towards the medial side. Here I will draw. The artery is coming towards the medial side. Here you can see. Okay. So by this we can say that in the upper part of the canal, the femoral vein is exactly behind the femoral artery. Right. That is the reason, if you talk about the relation of the femoral vein in the upper part of the canal, it is exactly behind the femoral artery or posterior to the femoral artery. Okay. And by the time it reaches the lower part of the canal, the femoral artery is going towards, little bit towards, the femoral artery is mainly going towards the medial side, and the femoral vein runs towards the lateral side here. So that is the reason we can say that in the lower part of the canal, if you see in the lower part of the canal, the femoral vein is lateral to the artery. So let us discuss again. In the femoral triangle, the femoral vein is medial to the artery. At the apex of the femoral triangle, the vein goes behind the artery. That is, the vein is posterior to the artery. In the same way, in the upper part of the adductor canal, it is posterior to the artery, and by the time it reaches the lower part of the canal, the vein runs lateral to the artery. Okay. So now let us see the femoral artery here. This is the femoral artery. Okay. So here I am talking about the relations of the femoral artery. Femoral artery. The femoral artery in the lower part of the canal, because this is the lower part of the canal, gives off a terminal branch which is called as the last branch of the femoral artery. The last branch of the femoral artery is called as descending genicular branch, or it is also called as the descending genicular artery. So in the lower part of the canal, it gives off the last branch of the femoral artery, which is called as the descending genicular artery. So here I will mention, this is called as the descending genicular artery. This descending genicular artery divides into two. It gives off a superficial branch. The first one, it gives off a superficial branch called as the saphenous artery. It gives off a superficial branch called as the saphenous artery. You can see the saphenous artery accompanies the saphenous nerve here. This is the saphenous nerve. So the first one is saphenous artery. This is the superficial branch. Gives, that is saphenous artery. And next is the deep branch called as muscular branches. Muscular branch. This muscular branch here pierces vastus medialis, because one is the superficial branch and another one is called as the deep branch. Superficial branch is called as the saphenous artery which accompanies the saphenous nerve, and the deep branch called as the muscular branch that enters the vastus or that pierces or that enters the vastus medialis. Muscular branch pierces the vastus medialis, and after piercing the vastus medialis, it supplies the knee joint. It supplies the knee joint. Okay. So let us discuss about the contents of the adductor canal. In that, first one is the femoral artery. The femoral artery enters the canal at the apex of the femoral triangle, right? Apex of the femoral triangle. And in the lower part of the canal, it gives off a last branch of the femoral artery called as descending genicular artery. The descending genicular artery gives off two branches. One is the superficial branch called as the saphenous artery which accompanies the saphenous nerve. Another one is called as the deep branch called as the muscular branch which pierces vastus medialis. After piercing vastus medialis, finally it terminates by supplying the knee joint. So we studied about the first content of the adductor canal called as the femoral artery. Now after the femoral artery, let us see the relations of femoral vein in the canal. You can see here in the upper part of the canal, the femoral vein is posterior to the artery. That is what I told you, right? At the apex of the femoral triangle only, the vein is posterior to the femoral artery. So that is the reason we can say that in the upper part of the canal also, the femoral vein is posterior to the artery. That's what you are seeing here. In the upper part of the canal, the femoral vein is posterior to the artery, and in the lower part of the canal, it moves lateral to the artery, right? So this is medially and this is laterally. Okay? So it moves lateral to the artery. So this is the relation of the femoral vein with respect to that of femoral artery in the adductor canal. And coming towards the third content called as the saphenous nerve. So this is the third one. The first one is the femoral artery. Second one is the femoral vein. These are the contents of the adductor canal. And third one is called as the saphenous nerve. If you see the saphenous nerve, it crosses the anterior aspect of the artery. It crosses the anterior aspect of the artery from lateral to medial side, right? So this is the saphenous nerve. It is related anterior to the artery and it crosses from lateral to medial side. In the lower part of the canal, the saphenous nerve accompanies with the saphenous artery, right? It is also related to the descending genicular artery, and at the terminal branch of the saphenous artery is related to the saphenous nerve. So third content is the saphenous nerve, and the fourth one is called as the nerve to vastus medialis. So this is the fourth one called as nerve to vastus medialis. So I told you that take the femoral artery as a reference to explain. So if you see here, this is the medial wall and this is the lateral side, this is anterior and this is posterior. And I told you that this is called as the nerve to vastus medialis. It is lateral to the artery or medial to the artery? It is lateral to the artery. Only in the upper part of the canal, because in the lower part of the canal you cannot see the nerve to vastus medialis, right? So the fourth one is called as nerve to vastus medialis. It is lateral to the femoral artery in the upper part of the canal. So what are the contents till now? What are the contents we studied till now? The first one is called as the femoral artery. Second one is called as the femoral vein. Okay, in the femoral artery we also discussed about the branches, terminal branches of the femoral artery. Second is the femoral vein. Third is called as the saphenous nerve. Fourth is called as the nerve to vastus medialis. And at last we study about 5 and 6. This is the fifth one and this is the sixth one. The fifth and sixth are the anterior and posterior divisions of obturator nerve. The fifth one is the anterior division of obturator nerve. Here I will write as AD, PD, posterior division. So you can see here the anterior division of the obturator nerve terminates by supplying the femoral artery. Means it ends in the adductor canal by innervating the femoral artery. But if you see the posterior division, of the obturator nerve, it runs behind the femoral artery. If you see the posterior division of the obturator nerve, it runs behind the artery, and after it runs behind the artery, it runs over the anterior surface of the adductor magnus. For example, I told you that in the lower part of the canal, the floor is formed by the adductor magnus, which means if the artery is going behind the femoral artery, means what? In the lower part of the canal, it runs anterior to the adductor magnus, because in the upper part there is the adductor longus. In the lower part, the floor is formed by the adductor magnus. That is the reason we can say that the posterior division of the obturator nerve runs behind the femoral artery over the anterior surface of the adductor magnus, and after from the anterior surface of the adductor magnus, it finally terminates by supplying the knee joint here. Okay. So what is the fifth one? Fifth one is the anterior division of the obturator nerve, and the sixth one is the posterior division of the obturator nerve. And also one important point I want to tell you here, that we studied about the subarachnoid plexus, right? So here anterior division of the obturator nerve is taking part in the formation of the subarachnoid plexus. There are totally three nerves which are taking part in the formation of the subarachnoid plexus. One is the medial cutaneous nerve of the thigh, second is the saphenous nerve, and third is the anterior division of the obturator nerve, right? So here the fifth content, called as the anterior division of the obturator nerve, gives off branches to the subarachnoid plexus, and it terminates in the adductor canal by innervating the femoral artery. And the posterior division of the obturator nerve runs behind the femoral artery over the anterior surface of the adductor magnus in the lower part of the adductor canal, and finally it terminates by supplying the knee joint, right? So by this we finished about all the contents of the adductor canal. Not only that, we studied about the boundaries of the adductor canal, the extension of the adductor canal, and also the contents of the adductor canal. So by this we finished our first chapter of lower limb, that is the front of the thigh.